Whether you're a clerk or a waiter, an accountant or a doctor, your health matters.
Hello, welcome to Your Health Matters. My name is Dr. Tassila Tembo Peters. Today, we take you to the Teta Hospital, which is in Chisamba district, to look at a disease that has affected mankind for a long time. This disease is a chronic disease, it's infectious, and it's curable. This disease is leprosy. We have on the program Mrs. Beatrice Shankanga, the Principal Clinical Officer at Teta District Hospital in Chisamba. She will explain more about leprosy and how it is treated. We also have on the program individuals that have been affected by this devastating disease. And to start the program, here is what the public say they know about leprosy.
What I know about leprosy is that it's a disease that affects the body. Yes, and it can even lead to a certain affected part of the body to be amputated.
It's the disease that affects the body and sometimes can even lead to the brain cells where they become damaged.
Leprosy, this is a microbacteria that affects the skin.
Leprosy is a disease of the nerves, and it is caused by the bacteria which is known as the Mycobacterium leprae, which is similar to a TB germ. Usually the big nerves are the ones that get affected. The facial nerve, the big nerves of the limbs, and sometimes you have patients with lesions or rash on the body. Rash can be from can range from one lesion to multiple lesions on the body, on somebody's body. And when somebody comes to the clinic or to the hospital, we will classify them according to the number of lesions they are having, according to the presentation. And they will also experience some loss of sensation on those lesions that come out. And because of that, as the disease progresses, patients will start having pain sometimes in the lower limbs. They would feel like the bones are aching and all that. Sometimes they feel the body is not theirs because there's that loss of sensation. They may step on the fire, they may not feel any pain. They may be pricked by a thorn, they may not feel any pain. And some just discover that they are having lesions or ulcers, especially on the lower limbs. And also considering the history, you know, those lesions would be with the patient. They would try this cream for the skin lesions, for the rash. They will not go. They will try this and that. They will not go until finally the patient is diagnosed with leprosy. Of course, coupled with the other parameters like loss of sensation on the same lesions.
Obulwele mwanji ukwishiba efyo bwayisana ngu efyo butampa twali bwishiba kabiri mukwikala fifine twayikala abenji twale ikala abenji mkomboni umu baleta mplatira fine filia kula umfa ferimbina ngulenda kwatite mubiri wobe nangu nganyanta pa kintu iki akuti dimbi kuti wamona fyo mulopa kashi nayichena dimbi kuti wamfa fya mafupo kutoba kungani kumoluku nangu kutukondo bala mulemu naba fumo tukondo pantu bwali bapabiri kwali ba ati nilani kaswandala ni bali abakuti ati iminwe ngefifi ne fili iminwe anje irengira fe mpaka ya kita. So iyi akwe bati imfironda firefuma ili ani imbumba nomba yena amolu yarapuma ngatuko ndo tukulapuma fye sano kulapuma fye maningi kulapuma
For paucibacillary leprosy, treatment goes from 6 months to 9 months. And then for multibacillary leprosy, treatment lasts for 1 year. Sometimes it can go up to 18 months if the patient at some point defaulted the treatment. That's how it goes. So it's not a death sentence, it is treatable. And it is even better if somebody seeks treatment as early as possible, because one of the goals of treatment is to prevent disability. Once somebody starts having their toes off their bodies, their fingers off, then it means it becomes a problem, because it is difficult to deal with such issues, because now it has gone into a complication. Others have lost their sight, others have lost their limbs because of the same leprosy. But if somebody seeks treatment early, it is quite treatable. You find some, even if you meet them today, you might argue with them that they had leprosy at some point. It is a treatable disease. If somebody somewhere notices that they could be having leprosy, they suspect they could be having leprosy, I think it would be prudent for them to run to any hospital. I'm sure there are people who are trained everywhere. It's not only at Liteta Hospital, but all the district hospitals, there is usually somebody trained in leprosy. Leprosy is an old disease. It existed as way back as the Bible days. If somebody has got leprosy, they are usually stigmatized. They are rejected even by their own relatives.
Boma ngitulera babulu besu bakatukaka aita tulandi bamankuntu kitokakalira mono miaka tatu pakeza tulibanike
kale bali kuticha bulwa chipomonyo ngaba ticha ati muntu wajusama nkuntu ali mushaku kumupa chakulia alike enka ali mwakapu kumupa enka kapu kapata simini ati mwanwa ntomwa kapu angwayambura bulwa chibama nkuntu.
It's unfortunate that such people should be stigmatized, because leprosy is not easily transmitted from one person to another.
Penchivivi masura bururu wanu kai kuna utubona maso wanu tago bachibura tibaziba kubone tago kuina
Abowe abwendo babo mumasokole abowe abwendo babo munjira mubasokole abowe abwendo babo mubasokole abowe abwendo babo.
These people are just as human as we are. And you know, when somebody is on treatment, for example, multibacillary leprosy treatment, the bacteria become killed, and the person is as free or as safe as any other person, as any other neighbor. So there would be no need to shun such people, because they are not contagious.
Well, viewers, you have now learned a little more about leprosy. Leprosy causes a lot of stigma and isolation of those that are affected by the disease. However, this disease is very curable. Early diagnosis and treatment of the disease is important, so that people that are affected by it do not get the devastating effects of the disease. Also, so that the public is protected from getting infected. This has been Dr. Tarsila Tembo-Peters on Your Health Matters. Join us again next week at the same time for yet another exciting topic on Your Health Matters. From me, stay healthy.
It matters, your health matters, yes, it matters, oh. Whether you're a student or a mother, a